Hi, I'm Jana and I'm going to be presenting about pneumonia.
I'm Jean, and I was a patient at Kindred Lakeshore. I came from another hospital, and I had gone to that hospital with pneumonia, and I went into like a respiratory arrest.
She came into Kindred Chicago Lakeshore not eating, on full vent support, not being able to communicate, not being able to transfer from her bed to her chair. And I think that when she met the team here at Lakeshore, that really gave her hope in what we were going to do for her and with her to make her progress.
I worked the physical part of her. I worked in getting her in and out of bed, getting her into her motor scooter, bringing her down here, taking her outside.
But we just had the greatest time just running down the street. He pushed me fast, he pushed me slow, felt the wind in my hair. It may sound like that's not therapy, but that was therapy for here and here.
As a therapist, seeing her progress so well and being so happy and being able to communicate, for me, that's the best part of my job.
I really didn't know there was a possibility that I would talk until the speech therapist came. She put something in and had me make a sound, and it was like, I almost wanted to say, who made that sound? And she handed me a phone right away, and my family didn't know I was having that done. So my husband didn't know who it was. And the boys were so excited when they said hello, and I said, it's Mom.
She was very motivated to get back to her home with her husband and her family. And that's what I loved about Jean, because she never gave up.
I think they have two secrets. One is everybody seems to go above and beyond. And the other is, know it or not, they are a team. One person takes over where the other person leaves off.
She made huge progress here. She's at home with her family, not needing any device, any vent support, not needing her peg tube for feeding. That makes me happiest to know that we were able to get her to that point.
Pneumonia increases the risk of losing the ability to maintain daily life activities like walking, cooking, and even being able to use the bathroom without help. You can die from pneumonia. Every year, there are around 1 million Americans sent to the hospital with pneumonia, and about 50,000 of those die. When the deep lungs are injured or infected, pus accumulates there. Pus in the alveoli is pneumonia. Pneumonia is an inflammatory response deep in the lungs in the alveoli. Viruses that infect the upper respiratory tract may also cause pneumonia. Pneumonia can be bacterial or viral. The main difference is how you treat them. Bacterial infections has a greater threat to the heart. About 80% of pneumonia is bacterial. Most viral pneumonia causes aren't serious and last a shorter amount of time than bacterial. Signs and symptoms of pneumonia vary from mild to severe depending on the type of germ, age, and overall health. Symptoms include muscle aches, dry cough, abdominal pain, cold in the head or throat, fever with shivering, chest pain, and nausea and vomiting. You can prevent pneumonia by washing your hands, exercising, getting enough sleep, staying away from sick people, and quit smoking and vaping. To diagnose pneumonia, there are many different options. First one is the chest x-ray. This takes pictures of the lungs, the blood test, to see if the infection has spread to the bloodstream. The sputum culture, which is a test done on material you cough up. The pulse oximetry, it measures the amount of oxygen in your blood. And last, the chest CT scan. And this is a mix of x-rays and computer technology to produce a detailed image. A lot of times you can manage the symptoms of pneumonia on your own by staying home, monitor your symptoms, getting rest and staying hydrated, covering your cough and sneezes, washing your hands often, and staying away from other people. You can get antibiotics for bacterial pneumonia, and in more severe cases, it can be treated with oxygen therapy or oral rehydration therapy or IV fluids. COVID-19 is a disease that can spread to the lungs and actually cause pneumonia. COVID-19 affects the respiratory system, which is why it can cause pneumonia. Pneumonia and COVID have similar symptoms. COVID-19 symptoms include fever, cough, shortness of breath, runny nose, chest pain, and dizziness. In the U.S., there are 55,548 deaths from COVID-19 and 244 deaths in Minnesota from COVID-19.